You know, when you take a pill, you probably think it's, well, just the medicine, right? But what if I told you that's not even close to the full story? Let's get into what's really in your medicine and uncover the hidden ingredients that make it all work.
So get this, for some low-dose meds, maybe like certain steroids, the actual drug, the part that does all the work, can be as little as 0.04% of the whole pill. I mean, that's practically nothing, just a tiny, tiny fraction.
So, that leads to the obvious question, right? If that's the drug, what in the world is the other 99.96%? I mean, what is all that other stuff? And why is it even there?
Okay, so to figure this out, we need to know the lingo. First up is the active pharmaceutical ingredient, or API for short. This is the main event, right? It's the part of the drug that's actually doing the work, fighting the infection, lowering your blood pressure, whatever it's designed to do.
And that brings us back to that other 99+%. That stuff? It's called an excipient. And these things are basically the unsung heroes of your medicine cabinet. They're the hidden helpers that make everything possible. Now, technically, they're considered inactive, but trust me, without them, most drugs just wouldn't work at all.
So what exactly are they doing? Well, they've got a ton of jobs. For starters, they turn a microscopic dose into a pill you can actually hold. They help your body absorb the drug properly. They make sure every single pill has the exact same amount of medicine. And they even protect the drug so it doesn't go bad on the shelf. They're not just helpful, they are absolutely essential.
All right, let's break this down. First, let's look at solid meds, the tablets and capsules we all know. Think of making a pill as a kind of high-tech microscopic construction project. And every construction project needs a good toolkit.
So first up in that toolkit, we've got something called diluents. You might guess from the name, their whole job is to be bulking agents. They're just there to add some size and weight.
Remember that tiny little speck of the actual drug? A diluent is what takes that speck and bulks it up into a tablet that's at least 50 milligrams, something you can actually pick up and swallow. They also help everything get pressed into a solid shape. And yeah, if you've ever looked at an ingredients list, you've probably seen things like lactose. That's a classic diluent.
Okay, next tool in the box, binders. And yeah, it's exactly what it sounds like. They're the glue that holds the whole thing together. Seriously, without binders, your pill would just be a pile of dust. These guys provide the strength to make sure it survives the journey from the factory to the pharmacy all the way to you. They give the pill that solid form we recognize.
All right, this next part is pretty brilliant. We've just talked about how we need to glue the pill together, right? Well, now we need a way for it to break apart once it's inside you. Enter the disintegrants. I like to call them the demolition crew.
The second that tablet gets to your stomach and hits moisture, these things kick into gear. They basically suck up water, swell up like a sponge, and boom, they force the pill to break apart. This is so important because it's the first step to releasing the drug so your body can actually use it. Without a disintegrant, that pill could just, pass right through, totally useless.
Okay, so that's pills, but what about liquid medicines? Making a drinkable dose is a whole different ballgame. It comes with its own unique set of problems and, you guessed it, its own special toolkit of excipients.
One of the biggest hurdles with liquids, the taste. Let's be honest, a lot of APIs taste absolutely terrible. So sweeteners are a must, especially if you're trying to get a kid to take their medicine. But it's always a trade-off, right? Natural sweeteners like sucrose taste good, but can cause cavities. On the other hand, artificial ones are super potent, but they can leave that weird metallic aftertaste.
And of course, there's more. You've got solvents, like plain old water or propylene glycol to dissolve the drug in the first place. You need preservatives, which are super important in bottles you use more than once, to keep nasty microbes from growing. Then you add flavoring agents to help the sweeteners mask the bad taste. And finally, thickening agents make sure the medicine doesn't separate, so every spoonful has the right amount of the drug.
Okay, so up to now, these excipients sound great, right? They're the good guys. But there's a really important twist to the story. Because for the most vulnerable people out there, we're talking babies and young kids, some of these exact same helpers can actually be harmful.
And why is this such a big deal for kids specifically? Well, it's pretty simple. They can't swallow pills. For newborns, infants, toddlers, liquid medicine is pretty much the only way to go. And that means they get a much bigger dose of all the excipients that go into making a liquid formula.
Let's look at a really serious example. There's a common preservative called benzyl alcohol. For most adults, it's totally fine. But for a newborn baby, it's a completely different and tragic story.
Just listen to this quote from one of the sources. It's really chilling. The problem is a newborn's body isn't developed enough to break down the benzyl alcohol, so it just builds up, and in the case mentioned here, it led to absolutely fatal complications. It's a powerful reminder that there's no such thing as a truly inactive ingredient, especially not for a tiny developing system.
And here's another one we've already mentioned, propylene glycol. It's a fantastic solvent, it does its job really well, but again, for the little ones, it comes with some pretty serious risks. Here's the bottom line. It takes a newborn's body about 17 hours to process a dose of propylene glycol. For an adult, it's about 5 hours. So it hangs around more than 3 times as long. And when it accumulates, it can cause major problems. We're talking about the heart, the liver, the central nervous system. This is exactly why there are strong warnings against using it in large amounts for kids.
So, with all these risks, how do the people making these medicines even navigate this? It seems like a minefield, right? Well, they have to follow a very strict philosophy, a set of guiding principles all designed to keep the most vulnerable patients safe.
And these aren't just suggestions, they're hard rules. First, you have to have a good reason for every single ingredient. Second, the goal is always to use the fewest number of excipients in the smallest amounts possible. You absolutely have to know the safety data for the exact age group you're targeting. And a big one, you never ever add something just to make it look or taste a little better. It all comes down to one thing: safety first, always.
And all this really brings us to one final huge question. These hidden helpers, these excipients, are absolutely essential. Without them, medicine as we know it just wouldn't work. But at the same time, we have to be so careful. It's this incredibly delicate balancing act, right? Between making a medicine that's effective and making one that's completely safe for a tiny developing body. It really just goes to show you there's so much more going on inside that simple little pill than you ever imagined.